Hello, I'm Davey Alleman. I've been practicing dentistry for 11 years, and I am passionate about creating strong connections with my restoration and the tooth. And it comes down to this concept of the hybrid layer. Now, the hybrid layer is a term that is often used, but very few dentists really internalize. It was first introduced in the literature by Dr. Nakabayashi in 1982, where he coined the term hybrid layer, which described a partial or even a full demineralization of the dentin that is just a few microns in depth, followed by an infiltration of monomers and a subsequent polymerization process. Now, in order for you to have a stable dentin bond, you will have a hydrophilic component and also a hydrophobic chemical component that allows for this strong bond to this material that my dad likes to describe as slippery when wet. It's an homage to an older surfing video. Now, when we have partial demineralization, this allows for a process where we have a transition or a hybrid layer that is neither tooth, but a hybrid of resin and tooth structure. So there's an exchange process by which inorganic tooth material is exchanged for synthetic resin. Now, this connection can be so strong and the gap between this so small that a bacteria cannot physically enter this layer. With a total etch technique, we have a larger hybrid layer. In other words, the aggressiveness of phosphoric acid allows for a greater penetration of these monomers and subsequent polymers that are created in the hybrid layer. But the strength of the hybrid layer doesn't come from the actual thickness, but rather the very bottom of the hybrid layer, which measures at around 0.5 microns. Now, it's important to note that dentin is hydrophilic, it's water-loving. And so in order to create a stable hybridization, you have to have a difunctional monomer that allows for an interaction with the water-loving component in the priming step typically. So it interacts with the dentin, which is only 50% inorganic. Now, on top of the hydrophilic difunctional monomers such as MDP or HEMA, you will have a following hydrophobic step. Now, dentin bonding systems need to be both hydrophilic and hydrophobic. Now, just like with a salad dressing where you have oil and water, it will have a phase separation if you try and combine them in a single bottle system. So we always recommend to our dentists, always look for an adhesive that has a separate priming step from a separate adhesive step. So one bottle systems, universal systems, will always have inherent weaknesses, as it'll be difficult to create a uniform hybrid layer as these two important monomers are competing for different sites. The hybrid layer could be described as an interdiffusion zone. And in fact, Bart Van Merbeek in his PhD dissertation in 1993 described the hybrid layer in these different areas. That there are 4 interdiffusion zones. Now, the top layer is mostly collagen with some hydroxyapatite. The next layer has equal amounts of hydroxyapatite, collagen, and water. And the next layer, mostly hydroxyapatite and collagen, and the bottom layer is sound dentin. Now, our particular logo is an homage to these interdiffusion zones, where each of these layers have critical aspects that allow us to have strong connections that can mimic the tensile strength of the DEJ. The top layer of our logo, you could view this as hydrophobic BCMA that connects the hybrid layer to the restoration. The second layer, we have demineralized collagen encapsulated with hydrophilic and hydrophobic polymers. The next layer, there's a HEMA hydrogel with hydroxyapatite encapsulation by the dentin bonding system. And then finally, when we reach that sound dentin, there's 20% water, 30% collagen, and 40% hydroxyapatite, and just a tiny little bit of resin polymer. Now, the most stable hybrid layers will always be done with a gold standard adhesive. In other words, there's a hydrophilic step and a hydrophobic step to prevent degradation of this critical aspect of your dental restorations. Now, what does this mean for a general dentist? Well, every general dentist that I know, they want their restorations to last longer than their neighboring dentist. How do we do this? We have strong connections front to back, side to side, and top to bottom. Now, every cavity is slightly different, but the vast majority of the teeth that you are restoring deal with deep boxes, deep decay, or perhaps deep cracks. And the challenges of bonding to dentin, much less deep dentin, requires you to understand how critical it is to create a strong hybrid layer that is resistant to hydrolytic degradation, but more importantly, enzymes that can degrade the bond strength, such as matrix metalloproteinases, or MMPs for short. All right, this is a common scenario. Patient notices a little bit of their tooth is chipped away. In this case, on tooth number 12, or tooth 4 if you're outside of the United States, we have a deep carious lesion present. Now, after we've established vitality with a cold test, our goal will be to regain the strength and integrity of the tooth through our bonding process and preserve pulp vitality. So here is how the tooth presented. We have a small fracture on the mesial. The patient can feel this with their tongue. Tooth is responding normal to cold, so our focus changes to how can I conserve critical tooth structure but also maintain the vitality of this tooth. After opening the carious lesion and measuring the thickness of the cusp, then we can focus on our caries removal endpoint. Here on the mesial, we have a large amount of outer caries. This will have a significant decrease of bondability. On the distal, there is some infection, but not to the same extent as the mesial. Now, after careful excavation with repeated application of caries detecting dye, we now have a caries removal endpoint. Now, in this situation, which is not always the case, we were able to remove 90% of the infected dentin. So as I look at this tooth, I'm saying, what is my hierarchy of bondability to each of these substrates? As I'm looking at this tooth, I see caries-free deep dentin, caries-free superficial and intermediate dentin, and enamel. Now, in this situation, we have the potential to have bond strengths that exceed the cohesive strength of enamel. In other words, the bond of caries-free superficial dentin can exceed the strength of enamel. I'm going to say that again. The bond to dentin can exceed the cohesive strength of enamel, which is around 30 megapascals. But the only way to do that is to allow these slow maturing bonds enough time to develop before we start to layer with our restorative material of choice. After caries excavation, we modify the smear layer with air abrasion. Air abrasion allows these hydrophilic, water-loving molecules to have better interaction with the intertubular dentin while preserving the smear plugs in the peritubular dentin. After we've applied the primer, at this stage, then we apply our adhesive. Now, we don't want to introduce air in these instances because this will increase the oxygen inhibition and the film thickness of our adhesive. And then I polymerize for 20 seconds on the full setting. Now, as you're priming with a mild self-etch adhesive, there's an intense chemical interaction between the molecule MDP and hydroxyapatite, where we have a superficial dissolution of the hydroxyapatite that is caused by the MDP molecule. So the way they described it in this paper by Fukugawa in 2006 is that there's an MDP adsorption, and then there's a subsequent deposition of the MDP calcium salt, and it's extremely stable. So there's not just a micromechanical interaction that's creating a strong hybrid layer, but in this case, with a mild self-etch adhesive, we are seeing an ionic bond take place, where there's an electrostatic interaction between the phosphate end of the MDP molecule with the calcium found in hydroxyapatite. And so they kind of have these long carbon chains, and then the hydrophilic end is interacting with the dentin. It's truly, truly incredible to see these nano layers that Dr. Yoshida captured, as well as the proof that ionic bond could be established by Dr. Fukugawa. So after we've primed the dentin and we're creating this AD concept and forming an ionic bond that was just a pipe dream for the early dentist pioneers in bonding. Then we apply the adhesive. This is the hydrophobic component. It's basically just all long carbon chains. But this will actually give the interaction with our restorative material. So after we've light cured our adhesive, the film thickness will range between 40 to 80 microns depending on the gold standard adhesive that you use. Universal bonding systems, the film thickness of the adhesive is actually much less, and there's a potential that you would have no polymerization after curing. Now, this is a point of confusion for many dentists. They will think that the film thickness equates to the thickness of the hybrid layer. Now, if you're using SE Bond or SE Protect, which are the adhesives that I use mainly in my practice, the film thickness is 40 microns, but the thickness of my hybrid layer is only 0.5 microns in total thickness, and this is where we get the strength. With mild self-etch adhesives, we also have an additional 2 microns of reinforcement below the hybrid layer, which was termed an acid-base resistant zone, or oftentimes referred to as superdent. With a total etch system, we do not have this acid-base resistant zone. The hybrid layer is 5 microns, but the strength is still coming from the bottom portion of the hybrid layer, the 0.5 microns. In this picture, we have placed the adhesive. The adhesive is now cured, and this is when the clock starts in terms of the decoupling process that we talk about when we train dentists in advanced adhesive and biomimetic techniques. In other words, in order for us to reach a bond strength that is greater than the cohesive strength of enamel, we have to wait a period of time. After we place the adhesive, cure it, then we do a resin coating. The resin coating will be a 0.5 millimeter of flowable. You will cure this. In this particular case, we restored with an inlay. We have a deep box on the mesial, a box on the distal that isn't as severe, but I still want to make sure that everything is supragingival. But an inlay or an onlay will always have less stress to the developing hybrid layer and less strain to the residual tooth structure. So when we do a deep margin elevation, we will do this with thin horizontal layers. If we have space, we will place a polyethylene fiber to help mitigate polymerization stress to the hybrid layer and also help prevent catastrophic failures if the tooth were exposed to a severe stress. If you'd like to learn more about creating strong hybrid layers, check out the video link here in the description. If you'd like to learn more about our training programs, you will find our upcoming in-person and online programs taught by my dad and myself linked in this video description below. Remember, get bonded and stay bonded.